Siemens.
First, I would like to thank Professor, the department, and the university for the kind opportunity for us to share this presentation with you today. My name is Mina Munir, and I am the AT Clinical Application expert at Siemens Healthcare. And today we are talk about the advanced innovation in interventional radiology. What do we mean by innovation? Innovation is an idea, and this idea should fulfill three main criteria. The first one is to be simple, because no one need to have a complicated procedure workflow, and physician must get a benefit from it, and the patient must get an benefit also for it. So for physician, it must be simple, decrease the time, increase the accuracy, and for patient, it must decrease the exposure time and the amount of contrasts. So these main criteria we are looking for in every innovation we are going to describe in this presentation. In intervention innovation, we can serve different category, and today we are going to talk about the interventional radiology, especially. In interventional radiology, first we will talk about our innovation in embolization guidance, which is called single embolization guidance software. Unfortunately, HCC is one of the commonest malignant tumor in Egypt due to widespread of hepatitis C, and chemoembolization is one of the most common line of treatment, especially for inoperable cases. So in embolization guidance, we depend on three main steps. The physician will do the first one, and the system will do the rest of the steps. This is why the software is very simple. The first step is to mark the tumor we are going to treat, and the system will automatically detect all the possible feeder for this lesion and connect it to the burnt vessel and connect it to the tip of the catheter. With the overlay function, we can use this diagram to be overlay on the live fluoroscopy. So all the time, the physician can see the wire, the vessels he are going to treat, and the tip of the catheter. So it's one simple click. We just mark our lesion, and the system will do the rest of the software. So here we can do our step from the table side or from the control room. We can do it in both. Just we need to mark the tumor we are going to treat, and the system will calculate automatically all the possible feeders for these vessels and connect it to the tip of the catheter. Here's another question: how many lesions can we do by using this software? And the answer is unlimited lesion, or as much as we can. Because every time the system will calculate according to the lesion we are choose to treat, it will calculate the feeders we are going to navigate. And with overlay function, we can use our diagram to be navigated on the live fluoroscopy. So We can all the time see our tools while we are injecting to make sure that we are in the right position and in the right branches. Embolization guidance, not only for chemoembolization of the liver cases, we can use it at any embolization procedure. So we can also use it for prostatic artery embolization. As we see here, we just need to mark the prostatic adenoma or the prostate itself, and the system will calculate the branches. We just first need to take a DynaCT while our catheter inside the common iliacs, and the system will automatically calculate the feeders for the adenoma or for the prostate to embolize. And with overlay function, we can navigate these branches until we inject our treatment. And finally, we can take another CT or DynaCT to make sure that our treatment is in position. So to sum up, for embolization guidance, as we talked, we are looking for 3 main criteria. First, we need to be simple, so it's a one-click software. We just have to mark our tumor, and the system will do the rest. The other thing into a benefit for physician. The software increase the efficacy and decrease the procedure time. So it's a benefit for the physician. And also, it will get a benefit for the patient because shorter time mean short exposure time and a little amount of contrast injection. Another wonderful tool is called single needle guidance software, and we use it for biopsy mainly, but we can use it in any procedure that will need a guidance for a needle. We all know that CT still is one of the gold standard modality we are using for biopsy, but we already know that CT also has some limitation. Like in CT, we don't have a live images. We don't have all the static images, so we take a lot of runs to navigate our needle. And also the dose in CT is triple times dose of the normal fluoroscopy. In embolization, in needle guidance software, the step of the workflow is also very simple. I just need to take a CT, and then the physician are going to draw his pass, the target points and the entry point. And the system will do the rest of the software. As can we see, here we can do our DynaCT or CT, so we can precisely detect our lesion, and the physician is going to make the target points to mark a pass from the target point to the entry point. And after making our pass, the system will go automatically to the next step, which is advancing our needle. And when we do this step, a crosshair laser is integrated within the software, will turn it on to the entry side according to the line that the physician already make it, and started to advance his needle. Also, the system will calculate automatically 3 projections. One of them is a bullseye projection where the detector and the tube and the needle are together aligned on the same line, and another 2 projections where we precisely the best angulation to see our needle according to the track we already choose. And the physician can swivel between the 3 projections every time he advances the needle to see his needle while he is advancing until reaching to the target. And of course, after we reach our target, we can take another CT or DynaCT to ensure that our needle is in position. And another question, how many needle can we do with this software? And the answer is also unlimited needle. We can do unlimited needle by using needle guidance. So again, we are searching for our 3 criteria. The software is simple. It's just one click. I need to define my path after taking my COMP-beam CT, the target point and the entry point, and the system will do the rest. And a benefit for physician, the procedure will be more accurate and more easy. And a benefit for the patient, because it's a live imaging, we are advancing our needle under live fluoroscopy, so every time I advance in the needle, I can show the tip of my needle. And less dose exposure, because it's a fluoroscopy guidance, not a CT guidance. In neurointervention, we have a wonderful tools for treatment AVMs, and it's called Dyna4D. It's used for planning and treatment the AVMs. We already know that AVM treatment in neuroradiology has a lot of challenges, starting from complexity of the anatomy to defining the perfect way for access to treating my AVM. And we have, of course, the DSA, which give us a good phasing or staging, and we have the 3D, which give us all the possible orientations and angulation to navigate our AVM. And simply Dyna4D combine post benefit, because in DSA we only have phases, but we don't have all the possible angulation. We can use it to treat our AVM. And the 3D give us all the possible angulation, but it's like the phasing. We don't have time in 3D. So in Dyna4D, we have it post. We combine the 3D criteria and the DSA criteria, so we have phases within a 3D volume. So again, in 3D, we only have a static image. We can use it to search for the best angulation we need to plan our treatment for the AVM. But by using 3D Dyna4D, we add the phasing, because now we have the capability to have phasing to see our AVM is an arterial flow or venous flow, so I can precisely choose which angle I can use it, and with the capability of time. Thank you.